Good day, everyone. I am Janet A. Lacsa. Together with my co-researcher, Dr. Lady Jesus and Dr. Maria Cecilia Martinez, we will present our research entitled Nursing Students' Lifestyles in the Areas of Behavior. For the introduction, college years represent a major segment of the young adult population. It is the stage when the knowledge, absorption, and personality shaping is unique. By Hao Xiao, 2005. Usually, these years are represented with numbers of critical times that challenges the social and built environment of students, as well as their way of developing new social networks, having more behavioral autonomy and adapting to their new schedules, by Greeny and Company, 2009. During this period of life, these students typically enter a dynamic transitional period of new independence from their parents that is characterized by rapid, interrelated changes in body, mind, and social relationship by Pullman and Company, 2009. Many of them stay away from the families for a long time while taking up higher education by Subarao and Company, 2017. Making them to have high-risk sexual behaviors, thus increasing their risk for sexually transmitted diseases by Goldsberry and Company, 2015. For some, this period is a time for dramatic changes, leading to late nights of studying and plentiful amounts of stress. That is why it becomes easy to them to feel overwhelmed and pick up some unhealthy habits. They are now more prone to engage in risky health behaviors known to negatively affect well-being, such as physical inactivity, stress, and poor dietary habits. By Musinger and Company, 2017, and Yahia and Company, 2016. Others would feel like it is their time to step up and become more responsible. Healthy behaviors, especially in college years specifically for nursing students, play a major role in keeping their well-being. Exercise has been noted as having potential psychological and physical benefits, and academic achievements has been found to be positively associated with exercise habits by Saglam and Company, 2011, and Gis and Company, 2010. These healthy behaviors depend on the early adoption of healthy living habits by Mueller, 2010, and according to the study by Jess and Perez and Company, 2010, healthy behaviors is modulated by the socio-demographical variables such as gender, age, socioeconomic level, ethics, examination level at admission, and educational level of their parents. Therefore, investigating students' lifestyle is vital for developing tailored health promotion interventions aimed at improving their quality of life. It is the university environment that is ideal and cost-effective to help educate the student as means of developing healthy lifestyle by Chai, 2005. For the methods, this study utilized the descriptive type of research, specifically the descriptive correlational design, to determine the nursing student's lifestyle in the areas of behavioral will. Data were gathered using email, Facebook Messenger, and distributing the adapted and modified questionnaire from the study of Maria Luisa C. Aguada, which the researchers asked permission for its use. Respondents were selected using purposive sampling method as they satisfied the criteria set by the researchers as follows: that they are college students, preferably enrolled in the Bachelor Science of Nursing program, willing and able to participate in the conduct of the study. Frequency, percentage, weighted mean, t-test, and one-way ANOVA were used as the statistical treatment. And for the result and interpretation, I will give the floor to Dr. Lady Ann De Jesus.
Good day, everyone. I am Dr. Lady Ann De Jesus again, and I will be presenting to you the results and discussion of our research. Table 1 presents the demographic profile of the nursing students. It shows that majority of the respondents were female with 74% or 171 out of 232 respondents, while male was only 26% or 61 out of 232 respondents. With average family income at 44% or 102 out of 232 respondents. Level 1, 30.2% or 70 out of 232 respondents, and with good academic standing at 90% or 211 out of 232 respondents. Table 2 shows the extent to which nursing students manifest healthy lifestyle in terms of mental health. It illustrates that there is a high extent of manifestation of healthy lifestyles in terms of mental health with 3.89 as its overall mean score. Item number 4 about minimizing contact to other people who are also depressed, and item number 5 about pampering self with special meal, new item of clothing, or or something else that can be enjoyed when mildly depressed, ranked the highest, both with mean score of 3.9, interpreted as high extent of manifestation. And item 3, about joining in some activity that the student is good at, like singing, dancing, and others, when mildly depressed, ranked the lowest with mean score of 3.88, interpreted as high extent of manifestation. Table 3 presents the extent to which nursing students manifest healthy lifestyles in terms of family and social health. It shows that there is very high extent of manifestation of healthy lifestyles in terms of family and social health with 4.30 as its overall mean score. Item number 3, about having lasting relationship with family and friends, ranked the highest with mean score of 4.45, interpreted as high extent of manifestation. And item 4, about not minding having homosexual friends, ranked the lowest with mean score of 4.21, interpreted as very high extent of manifestation. Table 4 illustrates the extent to which nursing students manifest healthy lifestyles in terms of growth and development. It shows that there is a high extent of manifestation of healthy lifestyles in terms of growth and development with 3.94 overall mean score. Item number 3, about spending more time with family and friends, ranked the highest with mean score of 4.14, interpreted as high extent of manifestations. And item 1, about enjoying sharing experiences with friends, ranked the lowest with mean score of 3.83, interpreted as high extent of manifestation. Table 5 shows the extent to which nursing students manifest healthy lifestyle in terms of nutritional health. It presents that there is a moderate extent of manifestation of healthy lifestyle in terms of nutritional health with 2.79 as its overall mean score. Item number 1, about not eating beef or pork more than 3 times a week, ranked the highest with mean score of 2.95, interpreted as a moderate extent of manifestation. And item 3, about limiting the use of margarine or butter in food, ranked the lowest with mean score of 2.66, interpreted as moderate extent of manifestation. Table number 6 presents the extent to which nursing students manifest healthy lifestyle in terms of physical fitness or health. It shows that there is a moderate extent of manifestation of healthy lifestyles in terms of physical fitness or health with 2.85 as its overall mean score. Item number 1 as overall mean score. Item number 1 about doing exercise at least 1 to 2 times a week, ranked the highest with mean score of 2.97, interpreted as moderate extent of manifestation. And item number 3 about running in place, jumping rope, jumping, roping, or jogging up and down during television commercial ranked the lowest with mean score of 2.74, interpreted as moderate extent of manifestation. Table number 7 illustrates the extent to which nursing students manifest healthy lifestyles in terms of control of substance abuse. It shows that there is a very high extent of manifestation of healthy lifestyles in terms of control of substance abuse with 4.73 as its overall mean score. Item number 1 about not taking more than the prescribed medicine by the physician ranked the highest with a mean score of 4.94, interpreted as very high extent of manifestation. And item number 4 about not putting self-health and that of others in jeopardy when smoking ranked the lowest with mean score of 4.66, interpreted as very high extent of manifestation. The rest of the results and discussion will be presented to you by my co-researcher, Dr. Maria Cecilia O. Martinez. Thank you.
Table 8 presents the extent to which nursing students manifest healthy lifestyles in terms of safety and first aid. It shows that there is a high extent of manifestation of healthy lifestyles in terms of safety and first aid, with 4.15 as its overall mean score. Item number 3 about using candles and putting it on a safe place in case of emergency blackouts ranked the highest with mean score of 4.24, interpreted as very high extent of manifestation. And item 4 about unplugging immediately electrical appliances that smokes or sparks ranked the lowest with mean score of 4.06, interpreted as high extent of manifestation. Table 9 shows the extent to which nursing students manifest healthy lifestyles in terms of community and environmental health. It shows in the table that there is a high extent of manifestation of healthy lifestyles in terms of community and environmental health, with 3.68 as its overall mean score. Item number 1 about selling plastic bottles whenever possible ranked the highest with mean score of 3.75, interpreted as high extent of manifestation. Items 2.3 and 3, even though they have high extent of manifestation and mean scores of 3.63, they rank the lowest. This is about segregating biohazardous material and volunteering for or involving in community environmental projects through street cleaning and information dissemination and giving health education. Table 10 presents the extent to which nursing students manifest healthy lifestyles in terms of disease and disorder. According to the table, there is a high extent of manifestations of healthy lifestyles in terms of disease and disorder, with 3.98 as its overall mean score. Item number 1 about being aware of the 7 signs of cancer ranked the highest, with 4.06 as its mean score, interpreted as high extent of manifestation. Item number 3 ranked the lowest, although it has 3.93 as a mean score and interpreted as high extent of manifestation. This is about limiting and avoiding exposure to radiation. Table 11 illustrates the extent to which nursing students manifest healthy lifestyles in terms of consumer and personal health. It shows on the table that there is a very high extent of manifestation of healthy lifestyles in terms of consumer and personal health, with 4.49 as its overall mean score. For the highest item among table items, number 5 ranked the highest. This is about approaching a manager to complain about a defective products that I have purchased, which has a mean score of 4.64 and interpreted as very high extent of manifestation. Ranking the lowest would be number 4 about that being persuaded by products seen in advertisement, although it has a very high extent of manifestation and 4.39 as its mean score. Table 12 displays the significant difference between the nursing students' lifestyle in the areas of behavioral will when grouped according to gender. The table presents that there were statistically significant differences between the nursing students' lifestyles in terms of the areas of behavioral will, growth and development, nutritional health, safety and first aid, and community and environmental health, as determined by their SIG of 0.00, 0.00, 0.001, and 0.007 respectively, which were all lesser than p-value of 0.05. Table 13 presents the significant differences between the nursing students' lifestyle in the areas of behavioral will when grouped according to socioeconomic status income. It shows that there were statistically significant differences between the nursing students' behavior or lifestyle in all areas of behavioral will, growth and development, and so on, as determined by SIG of 0.00 for all areas respectively, which were all lesser than 0.05, SIG, which are all lesser than p-value of 0.05. Table 14 shows a significant difference between the nursing students' lifestyle in the areas of behavioral will when grouped according to year level. According to the table, there were significant differences between the nursing student lifestyles in the areas of behavioral will in terms of mental health, nutritional health, safety and first aid, and disease and disorder, as determined by the SIG of 0.00 for all the three areas. Table 15 illustrates the significant differences between the nursing student lifestyles in the areas of behavioral will when grouped according to academic standing. It shows that there were significant differences between the nursing student lifestyle in the areas of behavioral will in terms of mental health, nutritional health, safety and first aid, and disease and disorder as determined by their SIG of 0.00 for all the three areas. Now for the conclusion. Based on the results of this study, the null hypothesis was rejected to a point where there were significant differences in the areas of behavioral will in terms of growth and development, nutritional health, safety and first aid, and community and environmental health when the respondents were grouped according to gender. There were also significant differences in all areas of the behavioral will when the respondents were grouped according to economic status income. There are also significant differences in the areas of mental health, nutritional health, disease and disorders, and safety and first aid when the respondents were grouped according to year level. And lastly, there were significant differences in the areas of mental health, nutritional health, safety and first aid, and disease and disorder when the respondents were grouped according to academic standing. For the recommendation, it was recommended that nursing students must focus on improving their quality of life, and they must prevent negative conditions that could affect their healthy lifestyles. They should be involved also in the implementation of a wellness program to be developed by their school or university based on the results of this study. It will help in promoting a healthy living and preventing the development of a debilitating disease. For the nursing faculty, they have to supervise closely their nursing students that they should be more energetic, attentive, observant either in the classroom or in the clinical area. It will help them determine the strengths and weaknesses of their students, which is an important aspect in setting expectations. Lastly, for the nursing administrators to develop a wellness program based on the result of the study and implement it with the nursing students. Thank you so much and God bless.